support. We are honored to welcome Dr. Farzana Rizvi, a dedicated psychiatrist practicing in Lucknow with over 3 years of experience, clinical experience in the field of mental health. Her expertise in psychiatry and other focus on gender sensitive care make her an ideal voice for this important conversation. So I am making the handed over the session to you, ma'am.
Thank you so much. Thank you all for being here today. I'm Dr. Farzana Rizvi. I'm currently working as a senior resident at KGMU Lucknow, and I'm honored to speak with you about a topic that affects millions of women around the world, including me, that is stress. So we all experience stress, but women face a unique biological, psychological, and social challenges that shape how stress manifests and how it is managed. Today, I'd like to briefly explore why stress in women deserves special attention and what contributes to it and how it impacts health, and most importantly, what we can do about it. So, firstly, it is very important to understand the unique stress landscape that affects women. Now, stress in women is the normal physiological response to perceived challenges or threats. However, women are more likely to report higher level of stress than men and are more likely to experience stress-related disorders like anxiety and depression. What is the case? So what we need to understand that biologically the female stress response differs from that of men. Hormones like estrogen and progesterone, which are our own unique hormones, they interact with the brain in the form of the hypothalamus, pituitary, and the adrenal axis. Now, this adrenal gland, some of you will know, will produce the cortisol, which is also known for the layman as the stress hormone. For instance, estrogen can heighten the reactivity to stress, especially during reproductive transitions like puberty, pregnancy, postpartum, and menopause. As a matter of fact, many psychiatric disorders are associated with stress experienced during the reproductive cycle, like the premenstrual dysphoric disorder, and during the peripartum period known as the baby blues, and a more severe form of it known as the postpartum depression and postpartum psychosis. So this was the biological landscape of stress experienced by women. Now let's talk about psychologically. Psychologically, women are often socialized to prioritize others' needs over their own, making self-care more challenging. There's also greater emotional labor in caregiving roles, whether as a mother, daughter, partner, or even as professional. Then let's talk about the social aspects. Women often juggle multiple roles. In today's society, a woman is juggling roles in the form of career, family, caregiving role, household responsibilities, and the face of gender-based pressure and inequalities, which compound the stress levels. Some of the common sources of stress in women can be linked to work-life imbalance, relationship and family issues, financial concerns, the expectations of the society around the world, appearances, and success. Then it can also be associated with trauma and abuse, which is very commonly seen in women. What's important to understand is that chronic stress isn't just in the mind. While acute stress might have some beneficial effects of getting the work done, but chronic stress has adverse effects on the body as well. The impact on chronic stress in women can lead to certain very important consequences like cardiovascular health issues, like having a heart attack, having stroke. It is also linked to autoimmune diseases. Like a lot of you must would know that autoimmune diseases are more common in women than in men. Then stress is also linked to digestive problems and reproductive challenges like menstrual irregularity, and sometimes infertility is also linked to stress in women. Then definitely a prolonged stress and chronic stress can lead to certain adverse psychiatric conditions as well. We're talking about a major depressive disorder, we're talking about anxiety spectrum disorder, we're talking about PTSD. So all these things are also linked to stress. Now, there are certain important signs to recognize chronic stress. These are some of the red flag signs: feeling constant fatigue, changes in appetite or sleep, whether eating too much or eating too less, whether sleeping too much or sleeping too less, feeling overwhelmed or helpless, increased irritability in daily chores, There's loss of interest in the usual activities, and then there can be physical complaints like having a headache, having a stomach ache, having body pain. Now, some coping strategies and interventions to manage stress that does need to reach more women are one. Let's talk about lifestyle intervention. The number one thing that can really manage stress is having a good night's sleep, which is highly undermined. A good night's sleep, having good sleep hygiene can greatly reduce stress. Then having a good regular exercise regimen, like exercising even for 30 minutes per day, or let's say even 30 minutes of brisk walk, has great impact on our sympathetic nervous system. It calms it down. Then practicing approaches like mindfulness, yoga, certain breathing techniques can also lessen the stress levels. Then certain psychological strategies can be cognitive behavior therapy, dialectical behavior therapy, improving coping strategies, and then social support. Social support is very important. It is very important to women to build a social network of women who are like themselves, and where they can vent out, where they can talk about the problem, because a lot of the times talking helps even in the worst of the times. Then, last but never the least, professional help should always be sought, for which we are always there. Because stress related symptoms that persist should never be minimized and considered as something in the mind. Because therapy, medication, and lifestyle changes can greatly impact a person's life. I have seen it within me, I have seen it in a lot of women. So, in the end, I'd like to say that stress in women is not a cause of personal failure. It is often a reflection of complex, systemic demands and pressure. And as a society, we need to recognize and support the mental health of women with compassion, resources, and empowerment. Thank you.
Thank you very much, ma'am, for enlightening us in this topic, because nowadays women did not care about themselves. They only care about their, not only their family, their career also, how to cope up with each and every situation. Now our trend is like that, because we are belongs to the Gen Z era. So, ma'am, it's my the session is truly helpful for me also, ma'am, and for all the us, not only for the patients and the caregivers, and also those who are actually suffering with these diseases, and and it is unrecognized. So, thank you again, ma'am.